We've gotten to know our patients over the last 32 years on a more personal, almost like family level for a number of them. We're at this point, we're seeing patients we saw as kids that now we see their kids. We started this practice in 1991 and have been in this location since 2006. So when we built this practice, it's sitting on 5 acres of wooded property right in the middle of the city.
From the moment you park in the car, you walk in, you go to your chair to get your teeth cleaned, it doesn't feel like you're in a dental office. It kind of feels like you're at home or you're up in a cabin. It's just kind of that nice, calming experience. So I think that's really, really unique. And then you couple that with all the technology they've got in here. You know, they've got the great pan, they've got the cameras, and they've got that CEREC, that single visit dentistry. I think that really does set them apart.
CAD/CAM, again, CEREC. I mean, I've gone through a number of different iterations of that over the years. Probably we're on our 5th different version of hardware and software at this point. Again, people come in because they can come in and an hour and a half later walk out with a fully restored tooth. I mean, that's a game changer.
And it does separate them from some of the other offices that don't have that, where they're more dependent on their labs and stuff. So I think that goes to the benefit of Dr. Taple. And again, being that early adopter back in '91, he saw the future of that technology.
Being able to read the patient and provide what they want, not necessarily what we think they want, is what makes it a great experience. So, for instance, somebody that comes in here, they've busted off a tooth and they think, oh, I'm gonna have to have this tooth extracted, or I'm gonna have to have a crown and I'm gonna have to come back a number of times. And being able to provide them with a crown and they walk out of here in an hour and a half and their tooth is fixed, that's a wow, right? So that's what makes people happy and that's what makes people come back. We equipped all of our operatories back when we built this building in 2006 with pretty much all ADEC equipment, not the x-rays, but the chairs and the delivery units and all that stuff. And, you know, I would say we've been in this building now for 17 years, and, you know, from an ADEC standpoint, we haven't had to replace any of it. It's as good today as it was 17 years ago. Like, say, from an ease standpoint of running the practice, I mean, for instance, we added in Revenue Well to our system, which integrates pretty seamlessly with EagleSoft. So we're able to, you know, patients can communicate to us through that platform. We can communicate back to them. We can send out mass emails for various different things.
So when the doctors do make a commitment to buy technology, it's very important that we implement it and we get it installed and we get them trained. So what Patterson does is they walk them through that whole process. First by bringing in maybe some new technologies for them to consider. And once they make that decision, that's something that they to move forward with for their patients in their office. We'll come in, we'll do the installation, and then we'll provide training. A lot of times we'll have manufacturer reps do the training, or we've got people at the branch, our CAD/CAM specialists that can come and sit with the doctor, sit with the team, make sure that technology is going to be used, it's going to be integrated, and it's working properly. They got great people when you walk in here. The doctors care about the team members, and the team members care about the patients. I think it's that whole culture in here.